The South African Medical Research Council, Wastewater, operates a wastewater surveillance program to detect signs of COVID-19. In recent weeks, the SAMRC has flagged increasing volatility in the concentration of COVID-19 RNA fragments in wastewater samples. To give us more insight on this is Mongezi Mdhluli, who joins us from the South African Medical Research Council. Thank you very much, Doc, for your time on ENCA. Just explain to us very quickly how this has made sure that we're able to detect COVID-19 early.
Good morning. Thanks for inviting us joining the ENCA. So we started as early as last year, just after the lockdown, and started sampling the wastewater. And the research is based on the research done internationally, where it was found that the RNA is shared through the feces, and it can be detected in the human feces.
Just explain to us, I see here you did a wastewater weekly. You collected samples weekly from about 70 wastewater treatment plants. And how exactly does wastewater make you see that there's a COVID-19 virus before time?
Absolutely. So we have the collaboration with different municipalities around the country. And as you've stated, that we collect the wastewater from those plants. So what happens with the individuals is that whether you are symptomatic or not, and if you have a coronavirus, you would shed it through the feces. So what passes through the human being is the non-infectious fragments of the RNA. So we would collect the wastewater and take it to the lab and look for those fragments of RNA in the wastewater.
And what would this do in terms of making sure, I mean, besides the fact that, of course, I can imagine the Research Council is, rallying behind government for people to get inoculated, but this study that you've done, how will that help us in terms of making sure that we don't have these high numbers?
So it's quite interesting as our program called Surveillance and Research Program, because you would recall that when the coronavirus started early last year, government sent individuals to go and screen people. And it was very difficult to make sure that you have people that are, you can do the proper screening, hence this program. So this is an early warning system that we could even see the coronavirus even on asymptomatic people as early as 2 weeks, even before it flares up when you get your spikes. So as we have warned with this, with our press release, we've seen some spikes, hence we call them volatile rises. And this is our idea to inform the officials. So the municipalities, we would inform them that there's a spike in a certain area so that they can go in and have some interventions.
And of course, I imagine, Doc, that you are also in the same breath telling South Africans to get inoculated. I mean, there's, for instance, been cases where political parties and organizations have said that, inoculation doesn't work for the 12 to 17-year-old, that group. But of course, we know that the South African government, rather, is trying to make sure that we reach herd immunity or some sort of immunity by the end of the year.
It's quite interesting because when we get ill, we go to the doctors, and the government made sure that it's not the one that tells us that the vaccine works. The government set up the advisory group, which is made up of the doctors, the specialists, epidemiologists, vaccinologists, and so on. So, we've put our trust in these individuals who've been taking care of us for a very long time. And come coronavirus, I think we have to share the same trust. It's quite important that to indicate that it's not government that is setting up the lockdowns. I think it's us, the individuals. It's our behavior that leads to the lockdown. Government is merely implementing what we do. So by vaccinating and practicing the non-pharmaceutical interventions, I think it will go a long way, particularly as we're facing the vacation, the December holidays.
And before I let you go, Doc, seeing how our numbers are increasing, I mean, a lot of people would say that the deaths are not increasing rapidly, but we do have infections that are increasing. We see ourselves praying not to have the same December we had in the year 2020. What's the Medical Research Council's reaction to how rapidly the numbers are increasing at the moment in the country?
I think the important thing, as you indicated, the deaths are still low, and one could possibly indicate this, relay this to the vaccines and other non-pharmaceutical interventions. I mean, we've seen in Europe, you've seen stadiums are very full and the numbers are rising. However, the deaths and hospitalization is quite low. So the importance of vaccination is not only about preventing transmission, but it's also reducing the numbers of hospitalization as well as the severe infection. So we as the MRC, I mean, we are supporting the government in terms of making sure that we have our population vaccinated. So I think it's quite important for the population to trust the medics as they inform us that the data indicates that the vaccination is effective for all these groups that are mentioned. So it's important for us to encourage our children and everybody, the elderly, to go and get vaccinated.
Thank you very much for your time, Dr. Mongezi Mdhluli from the South African Medical Research Council.